If you have chronic symptoms of gas, bloating, abdominal discomfort, especially after eating large meals, and if you've gone through all kinds of different tests, you have got your colonoscopy done, your endoscopy done, and we can't really quite figure out what's causing these problems, then there is a possibility that this is small intestinal bacterial overgrowth, or SIBO. So why is it that this condition occurs? Well, this is because of overgrowth of bacteria in the small intestines. And we know that we all have bacteria, large volumes of bacteria in our large intestines or gut or colon. That is where the home is for the bacteria, and that's where they should stay. But what happens is that in patients with SIBO, for whatever reason, due to motility problems or anatomical problems or functional problems or outside factors, the bacteria migrate from the large intestine or colon to the small intestine. Now, the small intestine is where actually largely the absorption of digested food should occur. And it doesn't happen in patients with SIBO. So what happens is there are two things that develop. One is that they don't properly absorb the digested food, so that causes a lot of nutritional deficiencies, diarrhea, and then of course other complications. The second thing that happens is that there is obvious appearance of symptoms or gut symptoms, which are basically gas, bloating, and abdominal discomfort. So what are the underlying causes of SIBO? Well, there are many things that can lead to SIBO. So one of those is anything that slows the movement of the gut. So it could be a recent episode of gastroenteritis. It could be medications that slow the movement of the gut. There are lots of people who are taking prescription medicines that slow our gut. Then there is also a possibility that people have neuropathy, for example, diabetes, which can slow the movement of small gut. And even the large gut, and then the bacteria start to flourish in the small intestines. Then there is anatomical abnormalities, for example, people who had previous surgeries or adhesions, they can develop SIBO. People who have gastric bypass surgery, they are at a high risk of developing SIBO as well, because not only they have smaller volume but also they have less amount of stomach acid, so their pH is disturbed, and as a result of that they develop bacterial overgrowth in the small intestines. So these are the main causes of SIBO or underlying causes of SIBO, and then of course there are other disturbances. For example, just a general overall dysbiosis in the large gut can also cause SIBO. Recent antibiotics or medications can do it as well. So what do we do about it? So once we suspect that SIBO is present, which is possibly causing these symptoms, and we've kind of ruled out other things or some of the more common things, for example, irritable bowel syndrome and other things, then we can confirm the diagnosis of SIBO by doing a test, and that is a hydrogen and methane breath test. And that test is done by drinking some sugars, and those sugars are basically they travel down the gut, and these are absorbed, and the bacteria in the small intestine chew on those sugars, or basically use those sugars to ferment, and then the gas is produced and it is released in the breath, which basically is detected, and then we know that okay, there is overgrowth of bacteria. Once the test is done and we have confirmed the diagnosis, now we can do the treatment. So the treatment is basically multifactorial. There are multiple things that we can do to effectively treat SIBO. The first and foremost is, of course, antibiotics that are not systemically absorbed, but they just stay in the gut and get rid of all these bacteria that are growing in the small intestine. So these are very effective antibiotics. After the course of antibiotics is done, then we need to do the most important thing, which is even more important than the treatment itself, which is prevention of future episodes of SIBO, or prevention of recurrence of this problem. Because if we don't do that, then people who are prone to developing SIBO one time are going to continue to develop more and more episodes in future as well. So how do we prevent the development of SIBO in future, or recurrence of SIBO? Well, we make sure that the motility of gut is maintained. So there are multiple things that can be done. So we need to make sure that our diet is very good. There are foods that are going to make us particularly prone to develop SIBO, so we don't eat those foods. Typically those are highly processed foods, junk foods. Some people are sensitive to dairy and gluten. Some people are sensitive to other foods. So we just kind of have to try to avoid those foods. The next thing is we when we are eating the right foods, we chew the foods properly, because if we don't chew properly, then that is also going to cause the development of bacteria in the small gut. The next thing to do would be that we develop the habit of fasting intermittently, because if we don't give rest to our gut, then the proper episodic peristaltic motion that is supposed to occur in the gut is not going to happen. So these people are going to develop a recurrence of SIBO. Another thing that can be done is use of functional foods that can prevent the development of SIBO. So some of those are apple cider vinegar, then there are some herbs and supplements that can be taken, and then of course there are over-the-counter medications like Ibicard, then there is Avirogast. All of these things can also help prevent recurrence of SIBO. Then the next thing is pharmacological medication. So there are medicines that can be taken to prevent the occurrence of SIBO. All of these things, and of course then there is the role of fiber. So all of these things combined together prevent the future occurrence of SIBO. And as you can see that all of these relate to a healthy lifestyle. So of course we can never go wrong maintaining and developing a healthy lifestyle. Thank you.